try to be nice to everyone. So if I am a cause of any sort of distress to anyone, let all us take the oath today that let us not be the reason of distress or the reason for tears in somebody's life. I would go from one ENT surgeon to another, go for these examinations, everything was normal. So they said this is, and ultimately somebody said that stress can do it. So I was always thinking that I am a stress-free person, but once I lost my life, then it came out that yes, over the years, the stress that I had seen, somebody dying in my presence, somebody getting resuscitated, and we are saving his life. But that would not make us happy. But somebody, some death, some neurosurgery patient dying, some heart surgery patient dying. So, although we try to be happy, I am always a happy-go-lucky person, but you never know the small amount of stress. Like 3 days I have been traveling, getting something for you people, and if I don't get it, I'll be under very stress. So my lesson to all of you is that I have an experience of so many years. Let us all be happy. We have issues. We have issues in our workplace, we have issues at home, we have issues with our kids, we have issues with our parents. We can never ever have a perfect conditions of working. So always think a positive thing you have in your life and be happy about it, and be thankful to the God for that. Yes, He has given us. So overall, this is an excellent institution to work. It was an experience, a very good experience for me to work, and I'm very happy that all the departments are doing an excellent job. We are here fighting for you. We had a meeting on Monday, and our health minister, she praised out of the way this medical college. And although I take the credit, but it is not alone. It is the hard work of all of you who are here working 24/7, our doctors, our residents, our paramedical staff, our nursing officers, the sanitation, the security, they are working hard. They know now that it is not a district hospital. I would again reiterate that this is not a district hospital. I, as a medical college principal, expect you to work in a way we expect in a medical college. So if you are, some of you need to be, now more efficient, more dedicated, more punctual, stress more on a government job, because if you are earning in the private sector, it is because of the government job here. You are writing professor outside, but you are professor basically here. You are earning money outside because you are a professor outside, but it is because you have been here since so many years. So my, request to all of you is work a bit more hard. We need a patient who is like dying in the evenings. We need some of you, the seniors, to come and give their duties. If you're on call, please do come. You're on call. You're once in a week you're on call. Please do come, because that will be an encouragement for the junior doctors also. Yes, the seniors are working. We know that we have done PG, we have done registrarship, we are consultants, but we know that if we come for half an hour, it doesn't matter at all, because I also come here. I also see what are the issues, and most of the issues I could solve because I could come in the evening hours. I could rectify so many of the issues because I would see what is happening after 4. Because I have a huge experience of being in OTs, being in ICUs, being in different hospitals. Like I have anesthetized the first anesthesia for ECT. I have given myself in an area which was not worth giving anesthesia. Dr. Mansoor knows it. We got some MSF doctors. They said that these patients are getting electroconvulsive therapy without anesthesia, and that is criminal. You catch hold of the patient and give him the electric shock. And once they came to us and they said that we want that this patient should get anesthesia before getting ECT. This is anesthesia in psychiatry. So we said yes, we will go. So everybody said that no, we will not go to psychiatry hospital because it's a social taboo going there. So I volunteered with my HOD. We went, and every Wednesdays I would go and anesthetize patients. And it was an area where anesthesia is really difficult. Then what we did over the years is that we had a hospital building where the OT has 2 OT tables with 2 workstations and 10 bedded, it's a recovery area. So it is in high advanced OT and recovery in a medical institution of psychiatry hospital. That is NIMHANS, it is Institute of Neuro Mental Health Sciences, Department of Psychiatry of GMC Srinagar. This is how the things get improved.
So there is a shortage of psychiatrists in the valley, Kashmir Valley में. कुलगाम डिस्ट्रिक्ट की मैं बात करूँगा तो we had one psychiatrist for the whole district. तो वो बहुत inadequate है. एक psychiatrist सारे डिस्ट्रिक्ट में हो वो बहुत कम है. तो उसके नीचे जो प्राइमरी हेल्थ सेंटर्स हैं, मेडिकल ऑफिसर शुड बी ट्रेन्ड इन साइकियाट्री, इन बेसिक जो कॉमन और साइकियाट्रिक प्रॉब्लम दे लुक इनटू, और एटलीस्ट दे नो जब कॉम्प्लिकेटेड कोई आएगा तो रेफर कैसे करना है. तो वो एक इम्पॉर्टेंट है. एंड आई फील कश्मीर में अभी फीमेल साइकियाट्रिस्ट कम हैं, but I have seen in the department, I have been going to the psychiatry department, I have been seeing the girls are coming in this field, for they are badly needed, female psychiatrists, lady psychiatrists are needed.
Extra questions for audience at the end. Nowadays, it's every third, fourth kid. A kid who's in his 15, 20, around that age group. This is our newer challenge in psychiatry.
COVID-19 pandemic, Jammu and Kashmir people have witnessed a lot of loss, uncertainty and traumas in many forms. When disasters hit, they not only hit our houses as structures, but they also hit our emotions and minds. So, this theme takes us to the thought that emergencies lead to increased psychiatric comorbidities, and 1 in every 5 people suffer from mental health issues post to disasters.
A much anticipated event that celebrates the blend of knowledge, curiosity and teamwork. As budding doctors and healthcare professionals, our learning never stops. Every question we answer or even attempt to answer takes us one step closer to understanding the vast world of medicine. Today's quiz is not just about winning, it's about learning together, thinking critically and keeping our scientific curiosity alive, which drives every medical professional to explore the question and understand the science of life.
So we'll pose first question to them. Michael Phelps, the most decorated Olympian of all time, suffered from which mental health issue? Generalized anxiety disorder, aquaphobia, attention deficit hyperactivity disorder, or bipolar disorder. You will be given 30 seconds. Okay, that's the right answer.
Little commentary for that.
Sincere and profound gratitude to our chief guest, respected Professor Dr. Rukhsana Najib ma'am. Ma'am, your gracious presence as our chief guest has not only elevated this event, but has also powerfully underscored the institutional commitment to mental health.
10th अक्टूबर वर्ल्ड मेंटल हेल्थ डे मनाया जाता है. तो हमारे मेडिकल कॉलेज अनंतनाग में भी ये पिछले 1 हफ्ते से चल रहा है और आज इसका हमने फॉर्मली इनॉग्रेशन कर दिया. तो बेसिकली एक हेल्दी माइंड और एक हेल्दी बॉडी इम्पॉर्टेंट है. कभी क्या हम देखते हैं कि कोई इंसान बिल्कुल हेल्दी चल रहा होता है लेकिन दिमाग से वो हेल्दी नहीं है. तो हमें ये अवेयरनेस देनी है कि मेंटल हेल्थ ज़्यादा इम्पॉर्टेंट है, हेल्दी माइंड, हेल्दी बॉडी और ओवरऑल एक अच्छे हेल्थ के लिए. तो इसलिए हमने ये हर साल यहाँ प्रोग्राम बनाते हैं. लास्ट ईयर भी हमने वर्ल्ड मेंटल हेल्थ डे मनाया था, इस साल भी मनाया. तो हमने पिछले 1 हफ्ते से इसमें एक क्विज़ भी किया है. इसमें बहुत सारे कंपटीशंस हुए थे, जैसे स्किट था, पेंटिंग कंपटीशन था, वीडियोग्राफी था, मूवी मेकिंग थी.